Testing the speed. Sound check. Check, sound check, sound check. Sound check, sound check. Sound check, 1, 2, sound check. Sound check. Sound check, sound check. Please. Good morning, all. We want to inform everyone to take our seats while we commence the 17th session of the HIV Prevention Conference. Session 16, right? Thank you. We'll be discussing about the importance of data integrity and accessibility in response to HIV prevention. It's important that we introduce the members of the business table. We have the chairman, the person of Mr. Bipin Yadav, the founder of Dore Technologies, a global digital health visionary person with more than 25 years experience in designing and executing global health care strategy for United Nations, more than 40 countries, international organizations. Currently, the one pilot in the Dore Technologies to become a global leader in leveraging futuristic innovation such as artificial intelligence, massive technologies, and so on. Mr. Vipin, welcome you to the high table. Take your seat. We have the co-chair, person of Dr. Bobby Pade. He's in public health and monitoring evaluation. Currently, strategic information specialist. After working for government, I stayed there for 8 years. Please, you're welcome. Very quickly, we'll be calling on our panelists. We have Dr. Gospel Morike. He's a public health and human development expert who has undergone several short courses in management, leadership, and development program, performance-based management, project system, and health system training. I know him. He has worked for SFH for so many years. I'm currently in the executive lead of Liamen Limited, a leading health and human development consultancy outfit. Dr. Moribi, please you are welcome. We have Mr. Bamidele Samson, a prolific and experienced information scientist with interest in M&E, information system, former chief of party of major evaluation in Nigeria. He has served in position as the SI, strategic information lead, and product for system development with interest in information systems and organizational development. Mr. Bamidele Samson, please you are welcome to the head. Please, pardon me, it's important and pertinent to as well not to allow the protocol to so-called consult at this point. I need to quickly retract and recognize the things of the government in our midst. For this purpose, for purpose of what we are doing, to have Mr. Francis Agbo, the Director of Research, Monitoring and Evaluation, Director of NACA, in our midst. We plead with you, sir, to join us at the high table. Thank you. With that, we have with us a very respectable and diligent diplomatic representative in our midst. The UNAIDS Country Director, Dr. Leopold Zenken, is in our midst. Please, we invite to the high table. We invite to the high table, sir. To the business table, rather. Because the business will take place here. So, I think I can proceed with the panelist. I want to quickly invite Dr. Pharmacist Chamberlain Onoha, a man with diverse work experience in both public and private sector in Nigerian sector for 20 years. He has worked as Director of Monitoring and Evaluation with Management Science Health, MSH, for some years, and currently the Deputy Lead Management and Strategic Information at Pelton Global Services. Mr. Chamberlain, you're welcome. We have Dr. Bartholomew Ochoye. He is one of the Nigeria's foremost human rights and public health program specialists with as well over 20 years of dedicated work in the field. Currently, he is the CEO of Heartland Alliance. Dr. Bartholomew, you're welcome. Lastly, for the panelists, we have Dr. Chigozie Wanfo, an M&E specialist working with IHV as the M&E in charge of the FCT. The space. So you're welcome. And very quickly, I need to introduce the keynote speakers. Ever reason in the course of implementation, the importance of data cannot be overemphasized. It's on that note we are going to have two presentations today, and the two keynote speakers are Dr. Greg Ashefo, a highly accomplished public health expert with over 3 decades of experience in Nigeria healthcare sector. He retired as the Director of Research, Monitoring and Evaluation of National Agency for the Control of AIDS, NACA, and currently the Country Director of Jury, a man with strong and sound track record in M&A research. You are highly welcome, sir. And we have Dr. Issa Dadel, a practicing public health physician with concrete experience in the HIV and AIDS in Nigeria, a fellow of International Society for Quality Healthcare. And good to know that he is the current secretary of the Quality Improvement Technical Working Group. And SI part are currently working with FICE3. FICE3, for those that doesn't know the full meaning, is Public Health Information Surveillance Solution and Systems. You are highly welcome. Please, we'd like to take your seat. Before moving on, I must introduce the facilitator that we facilitate and ensure that everything, as far as these sessions are concerned, are well done. I want to welcome Mr. Pradeep Kakatil, the Director of Global Partnership and Innovation at Drew Technologies. You're highly welcome, sir. And myself, so it will not be like I will introduce everyone and I will not introduce myself. Well, my name is Akiro Gudaki Tomide. I worked with NACA before I left, and I worked under the tutelage of Dr. Greg Ashefo for more than 2 decades. And here I went to politics to reshape the political economy of this country. And I'm back. I'm working for Dure Technologies as the program manager. And before I left, I was the national M&E coordinator of the states as far as contract evaluation is concerned. It is important for me to recognize the states that are here. Over 12. We have Jigawa Saka PM, the Zamfara Saka PM, the FCT Saka PM, and above all, we have their chairman who is representing them as a point of contact, Dr. Adedayo Adebulu. You are highly welcome, sir. But that's my host. When I went back home, we are from the same state. Thank you so much. Without wasting much time, we will call on chairman to give us his remarks.
Everyone, it's a pleasure to be part of this important session on data integrity and accessibility in the context of response to HIV prevention. And it's a topic which is very, very close to me. It's something I have been associated with when it comes to data and democratization of data for the last The journey for me started in and it was a very interesting experience because I got to the government bodies, I worked with the stakeholders, I worked with the global partners, and soon realized that a lot of the work that needs to happen in the data and the data ecosystem has to actually start at the ground. You know, it obviously requires all the prioritization from the partner, requires all the focus and the policy shaping aspects of the partners, but really needs to work on the ground. And that is where me and a few other like-minded people together and set up this platform called Dure Technologies. And it's been 12 years into this journey with a lot more focus on working with the countries that exist, with a lot more focus on having a bottom-up approach to our data strengthening exercise that we wanted to do with the country. And it's been an interesting journey so far. We've been working in 50 plus countries over the last 12 years as a digital transformation partner. And it's been extremely exciting. As part of the journey, we've been focused on, initially when we wanted to focus on data and data ecosystem, we realized we need to focus on the building blocks. And the building blocks was, the people itself, the capacity that the company needed to go. The building blocks was, how do we actually move from paper to digitization? The building blocks was, how do we actually build standard systems and standard reporting mechanisms for data? And then we could actually make mechanisms where data can be collected and used. So it's been a very interesting journey. The data and tech adoption has increased significantly. And I have to say, post-COVID, in many countries, including in Nigeria, it has accelerated to a different level, altogether. And I've seen some big global shifts, which are very interesting. I think one shift which I'm seeing in a short period of time is the move from system to solutions when it comes to technology. It's no longer about systems providing data management, but how technology can really improve the quality of service. That's very interesting shift I'm seeing. The other shift I'm seeing is when it talks about data, is how do we shift from databases to data ecosystem? So it's unlocking it from a prevention database, a treatment database, HIV database, or an NCD one, to how do we actually create a holistic ecosystem such that the states have access to all this information comprehensive, such that the last mile, first mile actually have access to the information at the time it comes. I'm also seeing a shift in the democratization of data itself, which is unlocking it from a few people who understand data to making it available to everyone who needs it at the time they need it most. And more importantly, to people who don't understand it, but need to act. So how do we transfer the data into action in a way that we can? And a lot of exciting things are happening in that space. I'm seeing a lot of bottom-up innovations which are happening in the country, like Nigeria, linked with AI, linked with other things which are converging together at the point of view. I'm seeing the role of communities, which is very exciting. From actually just playing a big role to being more integrated in the public health response, to make the health response far more proactive on the ground in the way it happened. And we've seen that in the COVID times, which has been very, and most importantly, I'm seeing the push where this mindset we had about the last mile, because everything was being done at the top and moving down, to that being the first mile. That is where everything is going. That's the first place where all technology is created and co-created. That's the first place where data should be used. That's the first place where any prevention exercises and other exercises we need to do have to be adapted and faster. So, because some of the global practices and trends that we see in the area, and I'm noticing Nigeria is very well poised to actually be the driving force in taking this up. So we'd love to share a lot of our best practices to discuss in sessions like this, how those can be adapted. At the same time, the sessions that are actually going on here, how do we bring in those learnings from here to the rest of the world. So we do work together, and very excited to be part of this, to see how the learnings from here become the center of excellence and become the model for obviously Nigeria, all levels, but then for Africa. So thank you for helping us be part of this session.
Please, can we appreciate the chairman again? Thank you so much, sir. We would like to have comment from the co-chair before we go to the business of the day. Thank you.
Thank you to the chairman for that beautiful remark. Picking on or two words from your remarks, I could say, as a country too, we have that direction. Looking at what you mentioned about compassion, moving from system to technology, and shifting from the database to ecosystem to enhance access to data. As a country, when we look at our HIV response, we have made a significant evolution, most especially in the area of reporting, data collection, reporting, and accessibility. And where we had fragmented HIV tool at the site with duplicates and some form of reporting to the healthcare workers. We have translated from that to a situation where we now have harmonized to wherever you are, you can definitely get information and track and program performance with the same tool across the country. Now, all these progresses has come with also MI system improvement. Presently, we are also from paper-based reporting and digitalizing our MI reporting. Now we have different digital tools across the country, and we also have worked the National Data Repository, whereby all this pool of digital tools fit into. And presently, we are trying to harmonize to ensure interoperability across all these different reporting platforms for data to for people to better access and for the better data visualization and data use. Also, as all these progresses and successes in the MI system has definitely improved the prevention program. We can easily track epidemics. We can use data to know where the hotspots, where there are trends of emerging trends for HIV, and we data help program appropriate to develop technology strategies in addressing that are tailored to those communities. So I will hand over at this point.
Thank you, my co-chair. Very quickly, we will be calling on Dr. Greg Ashefo. He's going to make the first presentation, importance of data transparency and accessibility to HIV prevention. Thanks.
Thank you very much, Shaki, for that. Before we start the topic, I have only 10 minutes to do justice to this. There's no way I can do justice in 10 minutes. So what I will do essentially is to set the tone for the discussion, panelists, and also the discussion. So with that, I appreciate the chairman, the co-chair, the king, and other high level participants on the high table. I salute you. Of course, chiefs who are well represented, I salute you. Appreciate you so much. So I quickly go to this. Before I also continue to, I quickly give you a short experience. When NACA lost the GF grant round one about 20 years ago, and was actually engaged to strengthen the system for reporting. So first assignment I had then NACA with my boss, Dr. Kadubumi, was to set a baseline for treatment, the country, HIV treatment, country, the current form treatment. So Dr. Sheglola, Harawi, and I went to the field and did a DQ. Then we came up with a figure. And happily, I presented this figure to my band, to TG. Not to mention TG now. I was thinking that I'll be applauded for that wonderful work. No, I was thinking that did you applaud me for that wonderful work for those the baseline for the country. Instead, I think they knock on the head for doing that. Why? From denial. And that is why I'm supposed to say that I established baseline for treatment in the country 50,200 in year 2005. But the digital, how about Greg? How can you do this? Last year, I reported to the president that we have about 60,000 for treatment. How can I go back to the president and tell them only 50,000? It's not possible. Anyway, I won't take your report. And he went to reported 70. He called a non-MIA person, a become person. How many people on treatment in the country? I don't know. She got a figure. I should reported 78,000 people on treatment. You have done my work. So that is part of the problem. Without passion, you can drive this presentation. So I'll be speaking on the importance of data and accessibility in response to HIV prevention. Next slide. Good enough, Nigeria has actually set legal framework for established HIV system in the country. There was a decree in 1998 which led to the creation of national MIS units in all ministries in the head. And I'm good enough to know that your HIV response aligns with the 3-1 principle and MIS seconded. And data transparency over the years, as well as has been an issue. Data quality. Next slide. Next slide. So what data transparency? So it refers to the accessibility and action, which include diagnosis, treatment outcomes, research findings, and public health initiatives. Also, it involves making relevant data available to healthcare providers, researchers, policymakers, and everyone in the acceptable format. Put that slide down for you. You miss it. Okay, next slide. And what is the impact of healthcare through transparent data? What is the impact of this? The first one is early detection and intervention. Time and move fast. Optimization of your services, research advancement, and public health inform public health policy. I wonder how many policies were actually informed by data, but you have a transparent data to inform genuine health policy that will create great impact. So in summary, data transparency in HIV healthcare is essential for driving improvements in detection, treatment, research, and policy development by ensuring that information is accessible, accurate, and actionable. So transparent HIV data empowers stakeholders to work collaboratively toward ending HIV epidemics. Achieving HIV is very control. So the importance is there for building trust among partners, stakeholders, everyone, patients in the community, empowering patients at all levels to take decisions, everyone who know about the disease. Also for program monitoring progress of the program and reducing stigma. Yes. So who and where and why we do have this? I just told you why important and why people are not transparent in giving correct data. This happens at the federal level, at the state level, and the local government level. Everybody is guilty. Who at the community level, also at the SDP, facility level, everybody is guilty of this. You go to facilities, they tell you they don't have data. I will speak more to this. They don't have the food is not available. I was in the community in Akwa Ibom. I don't know if okay, yeah, very good. Dr. Obak is here. I'm here with me. a wonderful for the state. I would have come in the state. I was there. How many people on treatment? Say 5,000 people. I said, great. It's happy. I'm doing fast. Then, now I ask, I want to actually wait for the queue. Udoka is a witness. I said, can I see the folders? Can you see the folders? Can you see the folders? And actually, we took up the facility. You know, they told us that this 6,000 or 5,000, forgot it, about 6,000 or so. 6,000 or so. Is it 6,000 more than that? 6,000, yeah. That only 1,000 folders are in the facility. That 5,000 folders are in the community, with the community. So is there where we document this? So we move to the community to see. Sorry, we can't access these folders. Why? I'm telling you live example. I've actually witnessed this over those 20 years, the responsible. So everybody is guilty, even facility level. Government is guilty, government is guilty. People are just government try to deny the achievement, and the donors too. Donors too. Well, I here, I don't want to judge anybody. All I know that everybody is guilty of this. I mean, people are laughing. They say, yeah. So with the IFPs, the government, I want to be at this drive for number, drive for targets. I want to be the best achiever. I want to meet. They deny our food too, also causes to political reasons too. I mentioned. Government want to have an agenda, and they must meet the agenda. So whatever figure doesn't matter to them. So they hide board figures and also release what they want. Next slide. This slide is very, very, I call it a teaser slide. I borrowed this slide from Chamberlain this year. Sorry, I didn't tell you for getting this slide. It was a nice one. I was proud of this slide. These are the findings. The slide is presented as the issues with the facilities. I put 3 issues here, challenges. One, you see what they discovered in the report. The rules are also applied to probation, distorted and altered documents. Why? Client folders, personnel, no correct data or information on this. The other one I find very interesting is that's why this is huge investment by donors made in capacity building and facility records remain only kept and some unavailable as I experienced in Africa State. So many. So I find very interesting really. These are some challenges I want to bring out. I will not particularly go in depth on this. Next slide. Despite this, we have strengths and opportunities. All is not gone. I said done so much. What it is, mention the fact that to go for paper based. I was telling somebody when I started, when I finished in Naka, related for facilities were on treatment, and I could sit on my table and call the heads. I'm on treatment. I don't have to put facilities. I only go there to validate from time to time. But I saw for me, the response grew from 34 facilities over 1,000. Presently, I have over about 2,000 facilities offering ART. So actually, there's a potential to do more. Beautiful NACA, through the support of Global Fund, has built an ecosystem that allow real-time data, also see what is happening, linking to various data sources, NTR, Roger 2.0, and so many data sources. And I'm proud to see that do built it. Clap for me now. Due to the support of Global Fund and the panel, I just made it Francis to scale down to states, so that states can have their station rules as we have in NACA, and also plan to actually expand the scope of digital ecosystem. So on the Ministry of Health, Vice-Secretary and PEF are supporting the NACA. Then there's also the level of government support who are all levels government support. And interestingly, it's increased awareness by stakeholders. There's MI instructional capacity at all levels have been established. Then the president of the reporting platforms, NDR, ERMs, and members. And the net ideas. So going forward, there's need to, to play down that to meet ambitious targets. So you actually be that should be a silent driver, and also to focus Ministry of Health and academic. Stakeholders and government systems and platforms focus on real-time nature of nature of data, and your partners and work with all stakeholders at all levels to build platforms that enable this, and focus on empowering communities too. Why we let the communities have a say? Could it be that communities will have a say? That's why we are having all these issues. So we should also strengthen communities to CLF. We have the eye monitor for TB. We also, sorry, HIV, and monitor for TB. So we tend to do this, and we're working closely with government to try to strengthen these systems to enable transparency and readily access to data. Yes. I think this should be the last slide. So once again, thank you for coming, and appreciate you for this. Thank you once again.
Thank you, Dr. Greg. Please, can we appreciate him once again? Taking us back to the late when the data, as it were paper-based, the days of Henry's 2005, 2006. I believe we still have a few of us that were part of the system here. Dr. Morgan, Mr. Fabulous Samson, Mr. Francis, and the veterans in this game, and the states as well, Dr. Adegulu and Ajay. Well, we appreciate everybody. Appreciate it. I think where we are today, we should be able to appreciate ourselves that we are moving forward gradually. Right, let's can we do that again? Very quickly, we'll take the next presentation. We have looked at data transparency and accessibility, how it affects our HIV program. Now we'll have to look at how the data ecosystem is strengthening the program itself. On that note, we invite Dr. Issa Daniel from Phase 3 to take us through his presentation, Importance of Data Transparency, Improved HIV Data Ecosystem with Strengthened HIV Prevention Program. You're welcome.
Good afternoon, everyone. Good afternoon to the chair, the deputy chair, and the members of the as you called it earlier. So, I think I will just start by saying, I think from all what we've heard, getting the data right begins with a foundation of data synergy and transparency amongst key stakeholders. So if we must really get it right, it must that synergy and transparency, so that at least people of all things bear then make it up easier. And I think Dr. Greg has really spoken about the need for all those qualities. So I'll quickly go through my slides. It might be a bit off, but I'll just try for the purposes of presentation. I'll just bring out the highlights. So next slide, please. Okay, so he introduced Phase 3. It's an acronym, Phase 3. It's public health information surveillance solutions and systems. I know most people say Phase 3, the way they normally get it's just an acronym. And basically, this is a CDC-funded project for PEPFAR. And it's basically into surveillance, performance monitoring, with a continuous quality improvement, AI, data science, machine learning, and all those. So, next slide, please. Okay, so just as a way of introduction, due to Nigeria's large population, the biggest HIV epidemic it stands as the country with the biggest HIV epidemic in West and Central Africa, despite having a relatively low prevalence. This prevalence depicts us into a large number because of the large population that we have. The current targets for HIV and treatment are all 395, and if we must be able to reach this by 2030, it means we should have gone far by 2025. So I think the lessons we have learned with the COVID experience has really taught us a lot. Taught us a lot in the sense that we need to establish a system that effectively manages resources and provide sustainable, secure, and prosperous. Provide a secure and prosperous future. But it means that to be able to work, things must change in the sense that that manual system that used to operate before needs to change. So the traditional approach of data management is no longer adequate, and that data must be shared across discipline sectors, platforms, truly to a digital society. So an integrated national data ecosystem supports the social contract for data by allowing cross-border data sharing and use of countries' data resources at the national, subnational, and sectoral levels. Next slide, please. So these are some of the key ways that is being proposed to enhance this data ecosystem, which can contribute effectively to HIV prevention efforts. So among data collection and integration system, real-time surveillance, targetation, quality data for program evaluation, predictive modeling, interoperable data systems, community engagement, and capacity building. Next slide, please. So for data collection, we do this, and I'm bringing it from a perspective of trying to see how we integrate the ecosystem. There are systems that are already in place to ensure this happens, and a typical example is what is being done. We are aware of the National Data Repository, the NDR, as helps to ensure that all the data from funders, what is done nationally, is pulled into a central repository, allowing irrespective of funder come, so that at the end of the day we have a platform that is ours, that is national, and is able to pull data together and report it as at when needed. So this is just to show the need of strengthening this, so that at the end of the day we have a robust system that allows for informed decision making, so that we are able to have data at when it's due or when it's needed, so that informed decision can be taken. Next slide, please. So, real-time surveillance. We know that in every and especially for our own environment specifically, there is need for that continuous surveillance of, especially as it concerns diseases, to happen, because the earlier you are able to get it, the better it is for all, because it means that you'll be able to intervene faster and quicker. And so basically for this, a lot of interventions are today, and for as it concerns prevention, basically one of the key highlights is the recency surveillance that happens, and we know the link with prevention is basically you are able to tell if that infection is new or not. And how this works for prevention is that basically if you are able to tell how new this infection is, it means that you are able to nip it in the bud, in the case that if you have such a case of new infection happening in a particular location, you are able to pick it early, so you are able to intervene early. Next slide, please. Okay, so targeted interventions. So basically, that is one of the highlights for data use. It should be available so that at any time we get it, we are able to take informed decision and take it decisively and at the right time. So to make systems better, there have been platforms that have been created for this purpose because of what has been noticed. As we mentioned earlier, like the NDR, it's a repository. So it's like a warehouse that allows data pooled and basically stored. So to see that you do a lot of analytics on the NDR might be a bit of a challenge because it means that you are going to put a lot of pressure on that particular repository. So a separate platform was developed, known as the NOS, and the purpose of NOS, that's National Analytic Workspace, is to allow you work off the NDR while you get data from the so the data you are getting from the NDR, real data you're getting from the NDR. The NOS provides a platform where you can go and do your analytics on because it's analytics, and we know how analytics have grown. And how wide it is, it means that a lot of tools have been provided on this platform so that you are able to customize that data that you have and tailor fit it to your own needs so that at the end of the day, you are able to give the person that requests that data the information he or she requires a blast. So basically, targeted interventions, that's what data will data to. The next slide, please. So the quality data for program evaluation. In this era that we are in, talking about getting the data right, it means if we must get the data right, it means that we should have to be able to say our data is of this certain quality. And for healthcare data, if there's any data that have the highest standards, it should be for healthcare because we know how critical it is in decision making. Because if you miss any, it means it's a case of between either maybe life or death. So it's very, very important that that data is gotten accurate. So we have seen collaborations, we've seen people working together in interagencies, as it concerns whether on the side of CDC, you said DOD, all agencies have come together because the getting data right drive is a drive for the national drive for everyone. So GON leads this, and basically this has happened collaboratively. Like I've even gone to a joint supervisory visits, DQAs, and other things that have happened to ensure that the standard of data that we are getting, we are really sure of, and we are getting it right. And apart from that, this has also necessitated events where quality improvement projects have been born out of, so that maybe where gaps have been identified, these gaps are, as the measures are put to ensure that these gaps are blocked. Next slide. So predictive modeling. In the age of machine learning, artificial intelligence, we know it's very critical since we know that it acts on human behavior, the science of trying to understand how the human thinks, how the human acts. So based on that, you should be able to predict some of the tendencies. So for example, there was a retention model that was built, a predictive model, and the purpose is to tell the tendency of a patient becoming lost to the job after a while, maybe from the history of how this patient has carried him or herself out, you will be able to tell this patient. So you know it's at risk, and because of that, the special patient that you follow closely. So for the policy of prevention, when we talk about these clients, we know that it's very important because writing on the principle of U equals U, untransmissible, and undetectable, untransmissible. It means that the lesser viral burden we have within these clients, the chances of transmission is far less. So it's very important as a prevention. Next slide. So interoperable data systems is what we have been talking about. There is a need for systems. No system should, or no system should exist as an island. In this present day and era, it means that there is a need for all our data platforms to have a way of communicating in such a way that for one particular time, you can actually see different components of data that is required, and it will help you see it from different perspectives instead of just sticking to one. So it's very important that all these are harmonized. And we have examples like the LIMS EMR NDR data exchange, the NDR SOMAS. SOMAS, we know it's a surveillance a platform that the NCDC uses. So this, and also maybe that's for the NDR, NHMIS, and also CISA development. A lot of them are things that we have to ensure happens. And these are just, it's just a tip of the iceberg. There is a lot of things that can happen within this that we operate. Next slide, please. For community engagement, I think the chair talked about communities, and presently, even as it concerns healthcare, in the development in developed spaces, we've gotten to an era where people want to see the customer, in this case, the patient or the client, being the one that is the driver's seat of managing his or her own health, basically, so that they can really tell you what they want, not us thinking we know what they want, but at the end of the day, trying to ensure that they decide and lead that particular trail. So in that light, there is an NDR light that was developed to ensure that data is captured at the community level. And if we are able to do this at the end of the day, NDR light will allow platforms, once you get your data on the field and it moves. So it means that we can get data at that patient level without much hassles. And with internet, it means that these things can move and move speedily. The next slide, the next. So capacity building, we know that for every initiative that comes up, basically it has to be driven first capacity building, because it's a new initiative. This is something that is just coming up, and then you would have to build, or you would have to train those persons that you expect to run that particular system. So for capacity building, it cannot be overemphasized. It's something that has to be continuous. Every day, we know that for the purposes of the continual attrition of healthcare workers and others, there's a need to continually build, maybe train, and also train. In that light, a lot of things has been done or has gone into it to ensure that the capacity of a lot of healthcare workers built and is able to transit or transport it to better service delivery across healthcare facilities. I'm rounding up. The next slide, please. So, in conclusion, by enhancing the HIV data ecosystem through this strategy, HIV prevention programs can become more targeted, efficient, and responsive to evolving challenges, ultimately contributing to reducing the HIV incidence and improving public health outcomes. Policymakers can focus on putting necessary data governance in place to develop trusted data platforms, unleash the potential of a country's data resource, and identify the new data-driven solutions to country systems and challenges. Thank you.
Thank you. That's a good one. I think we have had the presentation, we have our comments and everything. I have to call on Mr. Pradeep Kakatilu, who will facilitate the next session. So, for panelists and the audience, matters arise. You're welcome, sir.
Thank you very much. I think we should let you continue because you've been keeping everybody engaged, and the other challenge is that I don't know anybody in the room, so that's not the best way to start facilitating a panel. So I'm going to do a little bit of a trick. I would love to ask each one of you to introduce yourself, but this guy will kill me. So I'm going to ask, how many of us are from the community organizations or civil society? Can we put our hands up? Okay. Thank you much. officer from SACA. Okay, thank you very much. Saska, thank you. Yeah, sorry, I'm confusing too many different country structures, but thank you very much. Saska, some nice example. Thank you. And how many of you are from the, how many of you work on technology? Okay, fantastic. And you are from the national NASA. Okay. Thank you very much. Thank you for being here. I think we have a really interesting time. We have some amazing experiences to share. But before that, one thing I used to do this program back home in India, and the one thing which we learned was to ask our audience what they really wanted. So when we're discussing data transparency, let me from the stage. If I can hear from one or two of you, what are your what biggest challenges? What would you like the data ecosystem to? Yes, exactly.
Okay, thank you very much, sir. I think it's very simple. The major issue is if we go back to the last page of the last uh, the feedback. This is one of the major problem at the supply chain. Data was introduced in terms of data, but since the introduction at the for HIV, no any training, formal training was conducted, putting across, even inclusive of the major IPs that are listed. The data is ready. The data is being generated, but the capacity building to be put at the community, the health facilities, the LGA, and the state level is not there. And when this was not addressed, definitely we are not going to get data right.
Thank you very much. Yes.
Thank you very much. Let me adopt well-established chairman to the business table. Under principle of framework and one MI system, let me start from that place. Probably we did not start from trying to save now. NACA was introduced to Nigeria. Everything was said. The basis, the foundation of MIE, I'm sure should work NACA to start go in the direction. The truth is, there is a problem with data management in the country, which the partners are probably taking over. The problem starts from the beginning, of the source, of the service development. Have changes in the countries. So my colleague talked about capacity. Yes, you have capacity, but you have to change tools. It keeps changing all the time. And I've forgotten the number of times that's changed. It is important for national to take charge. Probably the partners have to take charge. So that affects whatever we at the state level. Targets us. Who set these targets? Is it paper? Is it big to let it happen at the state level? Or when you ask them, they say head office. Who is setting these targets? And so what I will keep talking about ownership. How do you own what you don't know? That you are not part of? And you want it to be transferred. And even when you transfer the data, you hardly get people. The only thing you get is whether it's not time or the interpretation of the data. The chairman spoke about it. How do we translate data into a informed decision? Does it make sense? And to be able for people collecting the data so that they can do more work. I think I'll stop there.
Thank you. That's a very powerful message about ownership. Anyone from the communities or civil society, what is the problem that you're seeing from the data side, and one thing that you would have for the experts to reflect on? Anyone? The voice of the civil society, where are you? You want to say something? Go ahead. You can use the microphone there. There's a chair here if you fall.
Um, Thank you so much. It will be a full supplement. Just to say that when it comes to community data, one of the major issues we have is actually having data scattered everywhere. When we look at CSO, discover that there's really no application when it comes to a singular framework that we share that all CSOs where data can actually be handled and then inform decisions made around all the various CSOs and all the various actors within the community. So that's actually a critical area we need to look at CSOs. Another part of or another issue that we also need to address as civil society was actually what I was discussing with the director of ESA, director of research and statistics the other day, which was around the interoperability of the data. We discovered that yes, Network, for example, who is one of the leading CSOs in Nigeria, here, have the iMonitor platform developed by Geo Technology. And, but you actually see that there's still no interoperability within the national system, or have national data interoperability system that's actually out written and staff, but still, we really don't have that connection where you can actually look at the data that is being generated from the community iMonitor being seen directly on the national data representation system, so that everybody, all actors within the Nigeria public space actually make some decisions as to some of the few things that are coming out from it. For me, there are two major areas that we need to look at the data, having a harmonized framework for CSO data at the community level across all CSOs, and we also need to see how we actually bridge the area of interoperability where everyone can actually see this data at national level, make informed decisions. Thank you.
Thank you. It's really good to see you again. We are going to turn now. Thank you very much for participating in this. I'm going to turn to the panel and then I'm going to come back to the question that has been raised. So let me move to the panel. And I might also ambush a few others who are on the who are at the business table that you called it. We'll do that. We can help with some of the questions to ambush. Let me start by trying to understand from the panel here. And again, I'm sorry, I'm going to keep you to 3 to 4 minutes per intervention, if that's okay. And then that gives us more time to engage. I think fundamentally, when we speak about data transparency and building a data ecosystem, what we really need is ownership, governance, and the ability to translate data information to action. Without that, data is not good. So, what can we do from your experiences? What can we do, and how can we really contribute, and how can we leverage technology and innovation, which is also something that we want to discuss today. Let me ask you a question, little question. What percentage of Nigerians between 16 and 60 own a mobile phone? Is it 50%, 70%, 80%, 100%? above 90, okay? Well, it's 99.5. That's almost everybody, okay? Because when we started, when the National HIV program was designed, and all the different, I would say, the design, they're not taking into account something as specific as this. It was very, very, very clever. But let me turn to the path. So, how can we leverage technology? How can we make the ecosystem work better? And how can we really build that ownership system? Make it easier the people who are responsible for making these difficult decisions. How can we leverage data to build the program? So let me call upon, I'm going to use first name, my apologies. You don't know my second name. If I were to tell you, you'll find it very, very difficult. So I'm going to use first name. You're all in it together. I call this as a family bonding to be one of the biggest challenges. So, Dr. Godspar, if I may call on you first, Sir, from your experience, you've been probably, I was introduced to you as a result of the AIDS response. So let me ask you, sir, what can we do? How do we work? How do we leverage data information?
Thank you so very much. I also want to thank speakers. I think they've done so very well. Like it's been said, young data. I think for me, following this evidence informed decision making. The issue is usually the my problem with the source is that you have very, very low capacity in terms of how to don't collect data, process those data. And I think it's quite a systemic problem in our country because before now, I don't know if it has changed, anyhow. Because you have people who actually need to collect data. They either somebody who is a clerk or a cleaner, who probably his next promotion is looking for something else. So what they do is they transfer that person and ask the person to be in charge of data collection, particularly in some, facilities. And so when you have that kind of system of people who don't have the capacity, the right basic qualification collecting data, then whatever you collect at that level, definitely going to be garbage in garbage. So for me, I think capacity building is quite key, but particularly at the source level, use the head facility. So who is responsible for collecting the data? I don't think we have any school in Nigeria we're able to learn about data collection. Yeah. So how do we build this system so that at that very foundational level where data is being collected, the persons responsible for data collection have the right skills and competencies to can build or not to get at that base level, whether it's collecting data electronically or collecting whichever the person to get the right the freedom has to put it in place for data collection. So that I will stop there.
Thank you very much. I think the whole issue of capacity is, I'm going to turn to, thank you very much, sir. I'm going to come back to the whole issue of capacity because it might be an interesting area where technology can really help amplify capacity. We can look at this technology. I'll come back to that, but thank you very much. Let me turn to Mr. Samson. Sir, capacity, what else?
Thank you very much. data that is ready. So that is so the global yes, the- what what ready you are using the every take for example somebody has taken somebody right time
Ladies and gentlemen, we apologize for the breaking transmission, but we want to make this announcement that time is up for this session. We are request that we will close the sessions now to allow the participants to go for their COVID break.
understand
Thank you so much.
help you to be able to help you to or you're doing proof your rest to prove your rest. So you have your that when you go higher level then after that where you put the so distribution. How you make what decision you take resource make it down. And decision that will give you an important take decision. Human resource. What you need. What the level of best what different kind of information. So getting what providing determining what type of data whatever level for you level of investment.
Very much. I think it's really about data is not just information. It's about helping you to take actions, which means it needs to be real time. It needs to be relevant to that local decision. Whether at different levels, it needs to be relevant. Let me maybe let me take a little bit of a detour from the agenda and ask this question. How many of you believe that I would quote the person who said this yesterday, but they said we can either make it or fake it. How many of you believe that we can make it? So we don't need to fake it, right? So what we need to do is, it comes back to your point, integrity. We need to make sure that the data is the right, highest integrity. Now, let me turn to the, because continuously integrity and the quality of data often are interconnected, but also links to capacity. So I'm going to ask Dr. Chamberlain, from your experience, where do you see the challenges? What do you see? Where do you see innovation and technology can come in?
All right, so good morning, everyone. I think it's been a very interesting discussion. First, let's look at that topic of integrity. What does it really mean when you talk about data? It means that the minimum of that data is protected from manipulation for presenting data in a particular, saying that this is what the data is saying. We got a knock 20 years ago. Between then and now, we have improved in several different ways.
Good afternoon, ladies and gentlemen. This is the time for the session. Is so much very much.
I can tell you that one particular index has not improved. Today, there's still a tendency that data is manipulated for personal and political reasons. I work for a technical support organization. In the past 3 years, we've probably done 7 assessments within health and outside of health. And what you find is consistency. You find consistency in the fact that there are too many players within that space who are interested in the data being manipulated, and that hasn't changed, right? And he did allude. So if we ask the question, what can government do? And many times when we do assessments in the field, we find that people say government can't do a lot because government doesn't have money. But I have at least 2 main areas where I think government can do something. And my brother here has talked about it. We looked at what on the hierarchy of things. People in leadership will tell you that everything rises and falls on leadership. So you can say that everything rises and falls on governance. And if you bring it down to this particular space, you say that if government can't hold anything, government has to hold governance. If you can't hold anything, hold governance. And how are some of the ways that you can implement it? And I think that sometimes we can just break it early more. Implementing partners, IPs right now are not only implementing, they are also the monitors of their own implementation, by and large. That has got to break. People really need to say it as it is. And I think that if government can't hold anything, government hold, getting everybody on the table to determine that when we talk about data quality, data integrity, data use, and all of this, these are the principles. And these are the expectations. Then government will take the sole responsibility of managing compliance. The one who is implementing as an IP, the one who is a donor, cannot be managing compliance as it is right now. So what it means is that when we've done it in all the sectors, and I'm saying all the sectors, it's not only in the health space, even in non-health sector. And even within the health space, within HIV, outside of HIV, you find the same. You find exactly the same thing. They are about similar tendencies around all of those. So I think that government will have to be the one that is managing compliance, and possible. Government has got to provide the resources for it, or make those who are supporting the programs dedicate resources that they will have used to manage compliance and make it available to government to use nonetheless. So those are some of the things I think that we can do. We can do. Some of the things you also find that's increasingly interesting is that there are also other areas I think that there has been a backlog. You see, everybody doesn't say, but some of those things are beginning to creep in. 20 years ago, Dr. Greg talked about when he got it up, we could call the facility head and say, what is my data? They tell you people current on ART is 30 in this health facility. Today, the average facility can't see that because they will tell you they are not sure of what algorithm the IP used to determine the current on ART. Unfortunately, many of the IPs are also telling you that they are not sure what algorithm that's used to determine the current on ART. So what does it mean? The man who generated the data can't own it. Some data, the IP can't own it. So who exactly is owning it? So it's pretty interesting. You're looking at me like I've exceeded my time. Maybe it's the time to pause.
I think I'm so glad that you've broken the boundaries of what is said. That's more important than the time. So well done. Thank you very much for that. I think we need to the two kind of challenges that is emerging is it fundamentally comes back to the three ones. We cannot talk about the third one without necessarily speaking about the first one, which is the national leadership. Now, I'm going to quiz a few others on that in a moment. Let me invite Dr. Bartolomeo. Where do you see, you're one of the large implementers for multi populations. Where do you see data coming from the community? How can we improve that? How can we make sure that that responds to the challenges that you're seeing?
Thank you very much for the question. So data definitely comes from the community. I can say all of our data comes from the community. However, going back to issues around capacity, I think the community pops up when you talk about infrastructure. There's no way you can have data integrity in terms of accuracy, consistency, and reliability without having basic infrastructure connecting with the issue around technology that you talked about. Now, what kind of tools do we use to collect data? That would determine the quality of the data you are collecting. Sometimes I go to the field and find out in some one-stop shops that the data collection tools are photocopied from photocopies. And so when you look at the data collection tool, you have to be somebody that have been using it for the past 5 years to understand what is on that. That's just a basic example. And that is the data that continues to go from stage to the other in terms of the data flow and ends up in the NDR that NACA looks at. So in terms of even assessing, I think that's the start from. Let's just assess where we are right now in terms of the data collection tools we are talking about, the technology, the infrastructure, what is even the policy environment. Somebody referred to, I think the CEO of the SACAS talked about the 3 1s, the 1M and E and all of that. Who is promoting all of those? And at what level are we promoting all of that? What are the policies at the national? How is it transcended or transcended to or cascaded to the states? How is it cascaded to the LGA? And how is it cascaded to the communities and end up where this data is being collected? What are the systems in place? It's not enough to collect the data at the community level, at the one-stop shops. In fact, beyond the one-stop shops, we have a fluid structure. You reference key populations.
this data could be collected at the bunks where people inject drugs. What systems do we have in place to ensure that the data collected in the bunk by the ocean somewhere, because they are running away from law enforcement agencies that might raid them and all? What structure, and if they are raided, how do we ensure that the data that is lost is collected? Because to find these people to collect the data again might be a problem. So it's a lot more complicated. And in terms of security and safety of the data, how sure are we that the metrics we are collecting from an MSM or a sex worker or a person who inject drug do not end up in the hands of law enforcement and they can use it to track? So I like to stop there because of our time, but these are issues that we address, and we need to be very open and transparent about it across all levels. Thank you.
Thank you very much. Let me quickly turn to the one person who maybe Dr. Francis sitting next to you. The challenges sitting in Naka must be difficult, bringing all these different pieces together. I would love to hear quickly your reflections.
Oh, it's thank you very much. First, let me say thank you to all the presenters. At least most of the feedback was targeted at government. So I used the opportunity to respond to a whole couple of things. So the first thing I'm going to say is that it is not a perfect system, neither is it a bad system. That is obvious. In the presentation, Dr. Greg literally gave us a chronology of where we started. We started with rudimentary, paper-based, that were fraught with errors and poor report. And Mr. Pamidele pointed out something: data use. The first place to detect poor data quality is even in the data use. When you use the data, you're able to tell if the data is of good quality or not. So the question is, are we the data? And this cuts across levels. Like Dr. Greg mentioned, way back, you go to a facility to do a GQ or something. What I used to hear those days was that they have come to collect their data. So they don't even own the data. So there are issues of individual capacity. And to address the question around capacity has not been built, we need to move from the era of traditional capacity building. You asked the question about how can we leverage technology. So as far as I know, or as far as I'm concerned, there's capacity building. There's capacity building you do for self, and there's institutional capacity building. And technology has made it easy for self-capacity building now. We have all kinds of YouTube is a place to go and learn. There are all kinds of Udemy, EDX, all kinds of things. So the best kind of capacity building to give to yourself is the one that you do for yourself. Continuous learning. So no matter how many times they build your capacity, there's still that need for capacity building. We live in a dynamic life as well as a dynamic response. Things are changing even as we speak now. So, but that is not to abdicate the role of government in building capacity of, for instance, national builds capacity at state. But you and I know that funds are doing. We're moving towards ownership and sustainability. Part of why we're moving towards ownership and sustainability is because the purse is shrinking. So, while in our capacity as government, and one of the things we also try to do is encourage implementing partners and donors. And I also want to respond that national targets are set by the government in collaboration with PEPFAR is sitting down here. A couple of the guys on the table have worked with GF. National targets are set by government in collaboration with everybody. So, but if the messages are not properly carried out in the states, that's a different matter. Because as an IP, I can go to a state and I begin to engage in discussion with state partners that, okay, these are the targets, and then you want to argue that, no, we don't agree with these targets, and then they tell you that, no, it came from HQ. And so it silences the argument. But national M&E plans are driven by government in collaboration with all the donors. Of course, the donors have their own targets, but all those donor targets are subsets of the national targets. So, issue of capacity also speaks to infrastructure at all levels. I recall working on a project, and then we bought EMR equipment and uninterrupted power supply, UPS. The facility had not even started using it when somebody plugged a kettle to the UPS and it damaged it. So, when we talk about capacity, it's not just about individual capacity of the people. What about, we're struggling with power as a country, So that too. So in other words, there are factors that are outside of our control. There are factors that are within our control, which we can try to address. So issues around interoperability, like the presenter said, there was a time in this country we were saying, all partners, dump your databases and come and use the central one in Federal Ministry of Health. It has never worked. It has never. So what everybody is talking about now is interoperability. Keep systems, but make it interoperable with the one in government. And like Dr. Greg mentioned in his presentation, currently we have what we call the HIV data ecosystem, which we are going to scale up. What we've been able to do is bring in NDR. The first thing we even did was make NDR interoperable with the NHMIS at the Federal Ministry of Health. So that HIV data ecosystem, because the whole idea about data is not transparent or accessible if people don't have access to it. So we should be thinking about systems that pull all these different data sources into one and then find how we can make it accessible to the people that need it. Whether it's academia, whether it's the people that generate the data, whether it's decision makers or policy makers. And so we have achieved almost 100% work with that because we pulled all these other data sources. We pulled NDR, we've pulled NHMIS, we've pulled ENRIMS, and then there's a plan to even pull in more. And even other disease areas outside of HIV are also looking at saying, okay, how can we also replicate this? So the challenges are there. We don't deceive ourselves that the challenges are not there. The challenges are there. Funding is diminishing, but we'll continue to do our best.
That's very powerful. Thank you very much. I think maybe I'm going to ask Dr. Leo, Dr. Napa, 1 minute each, but one question, even as I asked Dr. Leo to intervene. How many of you go to ChatGPT to solve all your problems? I love what you said about self-learning. I'm going to put Vipin on the spot in a minute to talk about how we can use AI and new tools for amplifying capacities. But Leo.
Thank you, Pradeep. I'm Leo Zeket. I'm the UNAIDS Continent Director. Very happy for UNAIDS to have being a key partner for this conference of the prevention. I'm being pulled out because the closing ceremony is happening very soon, and the colleague from UNICEF who was supposed to come and co-chair would not be able to make it. So once I take my 1 or 2 minutes, I will be leaving the business table. I'm extremely happy to see Jury Technology organize this session. More than 15 years ago, I was the regional office in Dakar as UNAIDS regional director, and we partnered with Jury Technology to do what? To do situation rooms. Situation room being an important tool to visualize data. And UNAIDS helped establish situation rooms in a couple of countries, Kenya, Cote d'Ivoire, and so on and so forth. It was an important tool for accountability. It was at the highest level. In Kenya, it was in President Uhuru Kenyatta's office. And in real time, he could see the number of people on treatment. He could see what was happening in each and every county. it was a powerful tool, so for accountability. So I'm extremely happy also to see now Dure technology has footprint, so in Nigeria. But we really want to congratulate you for being the first Dure technology director. Number two, I see data as a radar to fly your plane, right? So we use data to fly our plane to set target, trajectory, and then monitor whether we're making progress or not. So if that radar, meaning data, are not transparent, are not accurate, are not timely, our plane will crash. That's not what we want. So for us to understand where we are coming from. So the importance and then the power of data. So it is important when I sit. That will really go back to the governance of data at the state level. And I'm happy to see that the chair of the SACA is still bringing the 3-1 principles. So the 3-1 principle. I happened to have been in Washington in those days with Pradeep, when Pradeep was also working for UNAIDS, to design the 3-1 principle. It's about what? It's one coordinating authority. It's one plan, and then it's one M&A framework. And we even had thought at the point to add the fourth one, which was one basket, So that's where the skill. Francis, how can we help NACA, so all of us revamp, so that process of the 3-1 principle. And this is a time because the swap Minister Party is only talking about in the health system. It's one reporting, one budget, and then one compensation. So this is really very timely for us. And Minister Party is really seeing it at the integrated level, so in the situation where we pull everything together. And it takes me to the third point, whether we like it or not, how do we strengthen the partnership around data at the state level? Still say data for PEPFAR, data for this, do I see you nodding? So how can you help? How can we? So around it. Last but not least, how do we change the mindset? When you look at the data, as collecting data, he's collecting this data for PEPFAR, he's collecting data for somebody who's someone. And he is not his health facility. How can I use many of you nod in the head? So how do we change that mindset that primarily if I'm collecting data in Edo, in Ekiti, whatever it is primarily to improve, so program performance, health outcome in that facility. And if we did that, that would be extremely correct. So I want Mr. Facilitator, with your permission, so and then reiterate UNAIDS, when I say UNAIDS, it's not Secretariat, it's all the 11 co-sponsors working very closely, so with Dure, with the states, so to really make sure that in line with Mr. Spati's vision, so we can really strengthen and making sure that our data, which is our radar to fly our plane, being HIV, being TB, being maternal and child health, being whatever it is, so it's comprehensive, integrated, coherent, and we can see how we can move the process forward. Thank you very much.
Thank you very much, Leo, and thank you for being the radar that helps to guide some of these conversations. Thank you very much. Dr. Papa, you've been very patient.
Good afternoon, everyone. Can you hear me? Good afternoon, everyone. Okay, so I've listened in. I really, when I was listening to the copy, I didn't get you, Dr. Francis. Okay, when I was listening to when he said the system is not perfect, neither is it bad. It was quite a statement go out to, because I've kind of seen the program for quite a while, and there has been a remarkable progress, especially I say in systems, data management processes across hospitals in FCT. This can speak for them. So one of the areas that, while we're also talking, you mentioned capacity building. But I know that in addition to AI, one of the things that have happened recently and have been consistent over time, the facility staff are subjected to the echo training platform, which happens every state across health facilities in Nigeria, not just Abuja. So on those platforms, we're able to see that facility staff are brought to speed on different areas of the program. We can talk about EAC, data feed, data documentation, data collection, and just as it affects HIV management. So it's happening in Nigeria, just as I said. It's one of the areas that, over time is something, is an innovation that has lasted and has also improved knowledge across our staff, which has helped in capacity building. But the other area I wanted to actually talk about is the area of integration when it comes to data management and elsewhere. So sometimes you go to hospitals, you see that there are two data support that are used to collect data in the hospital. Now the HIV section has software, maybe the NMRS, and the regular clinic software, hospital software is maybe MedPro or something. So there's no integration. You still run the parallel system of MRT data collection, data reporting, and the truth is that by the time you look at it, the doctor is consulting, keeps reaching over these two platforms for him to get the information that is needed to manage the patient. Apart from that, there are some information that will be lost in the process. So I just wanted to say that, yes, I know that the government, compared to what it was before, the government is doing much more to be in the front of HIV management, and being that we're in an era of sustainability, the government has also done so well, and somehow I know that partners are trying as much as possible to make sure that the government is on the front of the program. One of the meetings I had recently, it was a quarterly review meeting where the M&E staff of facilities in FC gathered for a quarterly data review. So when they came, I asked, I said, "Do you have a work with someone who stopped it?" He said it's a data. I said, "Oh, data. That is data that is funded by the IP." And I said, "You are working against the law of gravity." For me, that's what, because that is your fault. So, just as the last speaker said, there has to be an engineering for the staff. This is what data assistance is meant to support. While we also have the core job to do, and you are all working together to support your core job, and you should even be the supervisor. So, so when all these things play out, you see that we still have a lot to do as much as we have come quite far. So I will say, all right. So I'll just say thank you very much for the opportunity.
Thank you. We spoke about going against gravity. You're all going against human nature. Lunch is going to be served. So sorry, but great. We should also have those conversations again. I'm going to break protocol again, and we've been come from having supported over 50 odd countries in leveraging technologies. You're bringing that to Nigeria. In 1 minute, Where do you see technology helping us in addressing capacity, in addressing transparency, in addressing scale up? Because we need to do things at scale. How do you see that? 1 minute, and then I'm going to go to Dr. Govinda, the co-chair, to summarize and take us.
Thank you. I was just listening to all the interesting conversations. Oh my God, so much. And I think we talked about it in a minute. I think we need a day workshop to go through this with passionate audience. It's amazing. But I also have a quick question. How many people here use WhatsApp in this audience? Looks like everyone. Yeah. How many people of you have been on using WhatsApp professionally? Sorry, I did not hear. Sorry, I just had to bring it up because I do think when we talk of technology, we talk about AI, we talk about, I think that's where I see us moving towards. Technology is becoming a barrier to some extent. I think the speakers here on the table were highlighting, it is there to support the process. And sometimes what's happening is the tools are becoming the barrier because you need to be trained on them so well, the data needs to be understood so well that you can't use them at all. And you just have to use it. So that's a big issue. And what we are seeing with AI, with some of these new technology and advancements, that it should become so simple that the capacity building and training should be so minimal. That's when it should be sustainable. Be so minimal that people who can use WhatsApp, people who don't understand data, people who want a conversation can actually collect data. The standards around data should be such that data that is being collected, even through conversations and otherwise, they can be interlinked because there is an enabling environment provided around the standards around which that data needs to move around. And then from a use standpoint, there were some very interesting things happening here. But the most important thing for me is how do you actually mine actions from this, the context, personalized actions, the context-centric dashboards, which are available for national use. Right? Part of the HIV data ecosystem work that we're trying to do is how do we personalize it at the state level? How do we personalize it in the context of the health facility there? How do we apply it to a way where you're getting a message on WhatsApp or otherwise that this is the potential action you can take for something which might be a risk that you need to address, rather than looking at a big dashboard. And when that shift happens, which I'm very excited about, the discussions here is happening in different parts of the world, and I see Nigeria probably leapfrogging that. Why? Because 99.5% of the people are using mobile phones here. Everybody here uses like WhatsApp and others and understands the need of conversing in real time. We don't need to explain why real time is important. WhatsApp. Approach, and I truly believe that next time when we have this conversation here, it will be a very, very good, very good. So thank you again for helping us be part of this.
Okay, so thank you to all our panelists. So I will just quickly summarize the take-home point from what they've discussed. It is now coming out clearly that to accelerate progress in HIV prevention and to be able to reach the most at-risk population with tailored intervention to meet their needs, it is key for us to further strengthen our data system, most especially in the area of ownership, governance, and capacity building. And this will further help in the sustainability of HIV response. And for the governance aspect, I believe the government are actually doing well. Maybe they may want to do more. They need to do more, but they're actually doing well in coordinating HIV since, and most especially when it comes to data, they are doing well. But probably based on the feedback, they have to do more. Then also, we've all seen that the country for this year, the country has really done well last year and this year in the data rights. And I'll give this to the governments. If they didn't lead the process, if they didn't lead the process, we'll not be where we are. Now we can boldly say this is what our data is saying. This is the true number of persons on treatment. All because of what they've done in coordinating the responses towards getting the data right. So now getting the data right has taught us to apply fidelity to our targeting, to our setting. coming from PEPA, our corporate this year was done with fidelity. We didn't set the target, we didn't focus on target, we were focusing more on quality. And so I believe that's what the country also is looking in that, and that the country also is looking that direction. Overall, I will say I will wrap up with the three main things that come out from the discussion: ownership, governance, and capacity building, most especially at community level. Thank you.
Thank you very much. Maybe just, I love the three summary points. So I'm also going to suggest three summary points. Let's say thank you to the business table once more. Let's say thank you to Dr. Greg and his team from Dure Technologies for organizing this conversation. And let me also say thank you for everybody who's here, because it was a passionate conversation. So I'm going to suggest one thing as we walk down for lunch. Find the different panelists that you want to ask questions to and make suggestions to. Demands of, if you have any demands, I know Dr. Greg is a good person to reach out to for solutions. So please do that, and then we will catch up over lunch. Thank you so very much. Really appreciate it.
Inform that we have to move straight to the plenary session, please, for the closing ceremony.